Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is the non-operative treatment of adult scoliosis. Adult scoliosis involves rotation and curvature of the spine due to degeneration. It's very different than pediatric/adolescent scoliosis. It's often painful. Most pediatric and adolescent scoliosis is not. It's stiff, therefore it's not going to respond to bracing. For instance, kids have scoliosis that is flexible. You can put a brace on it and kind of correct it and prevent it from getting worse. You can't do that with an adult. And adult scoliosis often causes both back and leg pain because of the pinching of the nerves with the arthritis, along with the arthritis itself. Adult scoliosis occurs because of one of two reasons. One, you could have adolescent pediatric scoliosis and it may just get worse. If you get skeletally mature and you didn't need surgery, but the scoliosis is around 40 degrees or higher, chances are it's going to get worse, around 1 degree per year. Okay? That doesn't sound like much. But if you're 20 when you're skeletally mature, and then you get to 70, that's 40 degrees plus 50 years of living, so you're talking about 90 degrees potentially of a curve, which is pretty significant. Or you may have no scoliosis as a child, and then you can get new adult scoliosis, and that starts with disc degeneration, and then you degenerate in the disc, and that pushes forces back to the facet joints in the back of the spine. Those get arthritis, but they don't get it symmetrically, so you end up getting asymmetric degeneration and a curve, and that's where you get the scoliosis, back pain, and then nerves start to get pinched, which is called spinal stenosis, and that can cause the leg pain. So the symptoms, as the arthritis from the facet degeneration leads to significant back pain. Okay, patients may all get muscle weakness and aching because they're trying to stand up straight. The scoliosis is putting them off to one side, so that can put a lot of extra exertion. And then buttock and leg pain can occur from the nerves getting pinched. So here's what you have. You see how this is a curve here? On the concave side, the nerves are trying to get out, they're trying to get out. They don't have much room. So this is where you'd have more of the pinching of the nerve roots and then leg pain on this side. All right? Now, the treatments for adult scoliosis are going to range. If it's mild to moderate pain, over-the-counter medications, anti-inflammatories, Tylenol may help tremendously. Prescription medications, higher strength NSAIDs, neuropathic medications for leg pain such as Neurontin or Lyrica. Narcotic medications can help. Topical medications, often prescription pain creams, can also be beneficial. Physical therapy, chiropractic treatment, and then there's interventional treatments. Facet injections put steroid and numbing medicine right into the arthritic facet joints of the back. Okay, that can provide pain relief for weeks to months. Trigger point injections, which are subcutaneous injections, can help with the muscle aching and weakness. When you look at medial branch blocks, basically they involve putting a needle around the arthritic facet joints, not into it, and putting steroid and numbing medicine where these medial branch nerve endings are that provide sensation to the joint. That can block that sensation and provide pain relief for weeks to months. Okay, when that wears off, then you can have what's called a radiofrequency ablation, which provides thermal energy and heat and deadens those nerve endings anywhere from 12 to 18 months. Okay. Now, for the leg pain, epidural injections can work well by putting steroid medication around the area of those pinched nerves for pain relief from the buttocks and the legs. Over 90% of those with adult scoliosis can achieve a satisfactory level of baseline pain without surgery. Between the treatments for back and leg pain, most people don't end up needing surgery. Surgery is an elective quality of life procedure. It should be a last resort because when you become an adult, you don't tolerate those procedures as well for scoliosis. They have over a 50% complication rate. Okay? They're long procedures. They may involve a lot of hardware. Even if you don't go up into the thoracic area, if you just go down in the lumbar area, it's still a lot of hardware, a lot of time, and it's a lot for an adult to take. Rehab time frames are 6 to 12 months. There's a lot of fluid shifts when you're on the table that long, and there's a lot of complication potentials. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options for all types of pain conditions with the board-certified, award-winning doctors. Visit us today at NewJerseyPainNetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.